How rampant is DEI in government in Arizona?
People are getting tired of this conversation. They're getting tired of having a lot of this very woke narrative shoved down their throats.
Where's the culture in the state? Is it moving more conservative?
It is moving more conservative based on DEI, the way that the border was handled, the fentanyl coming through. We were 200 overdoses a day in Maricopa County alone. If a 747 crashed every day in Maricopa County, I think people would have a problem.
I'm sitting here with Shamp, the Arizona State Senator, and thanks for joining us, first of all.
Thank you for having me.
Now, you sponsored a bill in Arizona that effectively, and I'll let you obviously explain it, but it effectively bans DEI in government. Is that a fair summary?
Yes, that is a very fair summary, yes.
Okay, so first of all, tell us a little bit more about the bill.
So the bill was crafted in kind of a unique way in the fact that we did not want to put into statute any of the terms that they're utilizing in DEI. We don't want that in our statutes. So that was why we took the reverse approach and made it about merit, that only political subdivisions of the state of Arizona.
Like what terms don't you want in there?
We don't want any kind of gender terms. The way that they're trying to ban DEI with some of these things is they're making sure to put in the trans stuff. They're making sure to put in sexual orientation. We don't want that in statute. What we want to do is to set up the structure as it should be, the way that the Civil Rights Act was created in 1964. It is based on capabilities, that we shouldn't be seeing color, race, where we come from, our religious beliefs, none of that.
So those terms are not in the bill. So then what precisely does the bill achieve then?
So what it does is it mandates that anyone that's hired to work for the government in the state of Arizona has to be hired based on qualifications, based on education, based on ability, previous job performance. So it focuses on actual merit of the employee for the job that they're interviewing for.
And what's the status of the bill right now? Is it passed yet?
It's about to go to the governor's desk, and so we'll see what's going to happen with it. I'm expecting a veto. I am. What's been interesting about by switching it from, banning and anti and making it about merit, it's really given them a hard time combating and having any kind of retort other than some rhetoric. So they just said, well, Senator Shamp is just mean. This bill is mean. That was the only thing they could come up with. So I'm interested to see what the governor decides to do with it.
You think it's definitely going to get vetoed, or is there a chance that it's not?
No, I believe it will definitely get vetoed. It has been straight down party lines all the way through.
Yeah. What is that? Okay, so you say the argument is that you're being mean. Is there any other kind of argument? What has the pushback been in Arizona specifically to this? Or is it just that this is mean?
That it's mean. And some of the conversations that were had in committee, in the Rage Committee in the Senate, they were asking me questions about, don't you believe as a nurse that people need to be taken care of by people that recognize their cultural needs and recognize what it is that makes them different, and so that it has to be a peer thing. And I argued that I'm very proud of the fact that I have spent so much time getting to know the different cultures in the places that I work. I mean, the reason why I ended up getting fired for not taking the COVID shot was because I was standing up for what I stand up for my patients, and that's their medical autonomy. The Navajo Nation has very specific beliefs, and I spent a year and a half working in northern Arizona and getting to know what those beliefs were so that I could deliver the compassionate care that they needed according to their culture. And it's kind of insulting that someone thinks that just because the color of my skin or because I'm a female, I can't deliver that kind of care. Because I can, because that's what we're trained to do as nurses, right, as medical providers. But slowly, this has been very insidious and coming into healthcare, especially in the acute care hospitals. You have to go through these modules and you have to check off that you agree with a lot of statements that were just really starting to get away from what the Civil Rights Act did and starting to kind of get to this politicization in healthcare where it doesn't belong.
Would this bill deal with the DEI in healthcare, or is it only in government?
It's only in government. But the one thing that I've learned in my short time down at the legislature is everything is about incrementalism.
Yeah.
Mm-hmm. And we know that we have very divided government. We have one of the most progressive governors in the country with the most conservative legislature that Arizona's ever had.
Yeah, how do you navigate that? Because I know this is always a conversation among conservatives do we take an incremental approach, or do you just go for the whole thing? And if you can't get the whole thing, is it even worth taking a little bit? Is this somehow a surrender to take the little victory rather than the big victory? For me, it's pretty obvious that you take whatever victory you can get in the moment, and then you go fight for the next one.
That's exactly right.
So in Arizona, that must be an interesting dynamic. It's just you got to chip away at it one little bit at a time, right?
Mm-hmm. Absolutely. I mean, I've been able to do some really good work in some other areas where I work across the aisle, because if we can agree on a topic that needs fixed for the citizens of Arizona, because the electorate is divided into thirds, a third Republican, a third Independent, and a third Democrat. And I take very seriously the fact that I represent all of my district and all of the citizens of Arizona. So to take an incremental approach with some things, to go for the full gander with other things where we have bipartisan support. So it ends up becoming something that you have to navigate and feel out and develop relationships and then work forward from there.
How rampant is DEI in government in Arizona? Is it because the other argument, I hear two arguments on DEI. One is, well, it's mean to get rid of it. Then the second argument is, well, this isn't even really happening. It's not an issue.
So it is happening, and we know it's happening, and we know that the people are not happy about it either. The polling that we have in Arizona matches the polling across the country, that this is an 80-20 kind of thing, and people are getting tired of this conversation. They're getting tired of having a lot of this very woke narrative shoved down their throats. And to me, it has no business in government when we're talking about the taxpayers funding these jobs. We should be hiring the people that are the most qualified, nothing else. And we have some situations right now with the governor has misappropriated funds as some of the accusals that have been going on. And some of it has to do with forecasting and budgeting, and it's extremely complicated. But we're starting to look at situations where there is some incompetence. So then I ask the question, why? Is it because of the hiring practices for the governor with that rhetoric? I think we have to look at that.
How do you think we got to a point where something like DEI was able to take hold to the extent that it did in Arizona, but also nationwide? How do you think we got to that point?
I'm not sure. I think it was just so slowly over time that, that we didn't really realize it was happening until it was so far that we went, wait a minute, what? That doesn't make sense. That's wrong. So I think it was a very slow kind of trickle into different areas. And then it just became something that was very important and became the whole talking point of the left, at least in Arizona.
Yeah. And has there been kind of a sea change in, we'll talk about the culture broadly, but in Arizona, of course, Trump won Arizona. You talk about progressive governor, conservative legislature. Where's the culture in the state? Is it moving more conservative? It is moving more conservative based on DEI, based on the way that the border was handled. I mean, Arizona is a border state, and every state became a border state under the Biden administration. I think we all know that. But Arizona literally is a border state, and the drugs, the fentanyl coming through, we were 200 overdoses a day in Maricopa County alone. There's 4 million people. If a 747 crashed every day in Maricopa County, I think people would have a problem. So it took a while, but once people were fed up, they were completely fed up. So there's been a lot of things that the progressives are still so far off on that we call it the 80-20. And so they just keep standing over on this 20% side, and their ratings are dropping. I mean, the citizens of Arizona have had enough. They really have. This is kind of separate from DEI, but you bring up immigration, and I am interested in that, of course, because we knew that once the deportation started, that we would start getting the panic and hysteria from the media, and they would put all the sort of crying illegal immigrants on camera. And that would be the test. Mm-hmm. Is that kind of emotional blackmail going to be enough for the American people to say, well, never mind, we don't want to do it? And it seems nationally like that's not the case. Like this emotional blackmail is not working on immigration anymore. I don't think it's working on any of these issues anymore. It's all the left ever had was emotional blackmail. Is that the case in Arizona, would you say?
Absolutely. Yeah, absolutely. So my seatmate is now the Speaker of the House, and last session we ran the Arizona Secure the Border Act. And so it was the first bill that I put up on her desk from the Senate. She vetoed it. And then he put it up out of the House. She vetoed it. So then when we turned around and we put it on as a ballot initiative, it passed at the ballot in November with 64%, and there was no money put behind it. And that's unheard of, right? When you put something to the ballot, you have to go educate the people so they know how to vote on it. Is not always is it very clear when you're reading these propositions on the ballot, which side you think you might know which way you're going to vote till you start reading it, and you get a little. It's convoluted a lot, oftentimes. So the fact that it passed, that's overwhelming. And so
what was the ballot measure exactly?
So Proposition 314, what we did is we took SB4 out of Texas, where it made it a state crime to trespass. In other words, coming into Texas or coming into Arizona, as we did it, through any place other than a lawful port of entry was a state crime. So this wasn't about immigration, because immigration is a federal issue. But we have the right, when the federal government does not protect our citizens, that we have the right as a state to protect our citizens. Actually, I would say we have a duty. And so what we did is we increased fentanyl charges. We also added, we have E-Verify in Arizona. And so what we did is we strengthened those penalties, because we don't believe that somebody coming from a foreign nation that is not a citizen should ever get any kind of services funded by the taxpayers. And so those three pieces, the trespass piece, those three pieces passed at 64% in the ballot measure.
Have you noticed any improvement on these issues just in the state, or has it not been long enough with the border enforcement to really see the impact yet?
When President Trump took office, it shut off.
Really, that
it was
quickly?
really fast. It was really fast, and we still have to recover from where we are, what was happening. I mean, our sheriffs down on the border, they need help and they need funding, but it's been incredible to watch the Trump administration come in. Director Homan just did a joint address with both chambers, and it was interesting because the Democrats all held up signs and walked out, and the signs they had were pieces of paper where they printed names of people that had been deported. And Director Homan had a very, very calm statement, and and then asked the question and talked about how they're able to walk out and they're worried about people that are getting deported. But do any of them even care, or would they carry a sign that had a child's name of the 347,000 missing children? Do they care about them?
Yeah.
So when they want to use that emotion, it's very easy to use actual data and use emotion behind it as well.
Yeah. Yeah, I would think showing Tom Homan a list of everyone deported is not going to be an effective way to shut him down, because I think he's probably going to be proud of that, as he should be.
Yeah.
It's just showing the effects of his labor. What do you think in Arizona, or just broadly in the culture? What's the key? What's like the key in effectively pushing back? Let's just take the issue of DEI. What's the key in effectively pushing back against it?
I think it's making sure that we're actually really talking about what it means. We're not actually being mean. You know, I mean, as an operating room nurse, I can't imagine any patient being okay with somebody being in their surgery that is not the most qualified for the job. That's all this is about. Who is qualified? Because we're not supposed to see color. We're not supposed to see sex. We're not supposed to see religious beliefs. Like, it shouldn't be. We are a melting pot. That's how we were created. So why is it that we're so hyper-focused in the wrong direction?
This is what I found, too, also, is that with a lot of these issues, you tend to think that you have to explain to people why it's, say, wrong to hire people based on race. You don't. Most of the time, you don't have to really explain it, because people intuitively understand. Mm-hmm. A lot of times, it's just a matter of pointing out that this is actually happening, convincing people that it is a problem, that it is happening. Mm-hmm. What do you think about your own take on the broader culture? Is there I think conservatives like to think that there's been I guess as the kids would say, a vibe shift, and the whole culture is moving, or I guess moving this way, right? Moving conservative. Do you pick up on that? You think that's
yes, I feel it. And I don't know if it's because we're shifting back to the right as much as people are waking up and going, this is wrong. And we have so much proof of how wrong it is in so many different aspects of our society. So I kind of think that people are just paying more attention. And I think it's been a culmination of all the things, right? And especially in Arizona with the border, the economic strife that people are going through. I mean, $10 eggs, that was a little ridiculous. You know, I have a lot of retired persons living in my community, in my district, and they're the #1 growing homeless population in the state of Arizona because of cost of living, whether it's housing or groceries and gas. And so that became a very big, so people are starting to engage more because they're feeling it more. You know, I'm just a nurse. I got fired and take my beloved career taken away from me, and I decided I'm going to run for office. I believe God tapped me on the shoulder because trust me, I was a travel nurse for 7 years because I don't like politics. I just want to take care of my patient. I want to do my job to the best of my ability and then go home at night, right? But when I was faced with the situation I was faced with, I decided I don't want this to ever happen to anyone else again, so I'm going to go see what I can do to change it. And I've learned so many things about so many different kinds of issues that I had never paid attention to before, and I would have considered myself a very civically involved person. So I think that whole thing is happening to a lot of people.
And you got fired for not taking the COVID shot?
Yeah, 2 months before the mandate was lifted. I worked the whole pandemic. And in the OR, I'm exposed to everyone's airway, right? We intubate pretty much every patient for surgery. And so we didn't know. There was a lot of fear, but we do what we do. And so then they offered me a cheeseburger and a gift card and all kinds of things. And finally, I got pigeonholed. And so there was no protecting. Because I was a travel nurse, so I was a contract employee. So it was pretty easy to pigeonhole me down. I got sat down in the office and said, you either get the vaccine and you have to do 3, or your contract will be terminated. So I'm like, can I have 10 minutes to think about this? I knew I was never
Right there on the spot?
Right there on the spot, yeah.
Wow.
And so I'm like, can I have 10 minutes? And I just needed to call my husband. I'm like, you know, I'm not doing this. I mean, we've had this conversation, but I'm about to lose my career. And he says, well, we could get you a fake card. And I'm like, I can't do that. It's not in my nature. And he said, then get fired and come home. We'll figure it out. And so that's what I did. And now here I am. Political outsider runs for office. And after my first term, I was elected as Senate Majority Leader. And I'm only the 3rd female to ever be elected as the Senate Majority Leader in Arizona.
And when were you first elected?
I was first elected in November of 22, took office in 23.
No political experience before that?
None. Hospital politics.
Yeah.
So.
And then so you mentioned 2 months after you got fired, they lifted the mandate?
Yep. Yeah. The federal mandate got lifted right after. Yep. But I still can't go back to work the way that I want to. And it's interesting because now I'm getting lots of phone calls because I was the first one to do a COVID committee in the entire country. It was before Senator Johnson did it at the federal level. And I ran it like a code debrief. And I'm very grateful to the leadership for allowing me to do it. There were a lot of parameters and controls put on it because at the time it was an extremely hot button topic. And 4 hours after we released the agenda for my committee, Rolling Stones did a hit piece on me. So I think everybody knew that I was coming in and I would want to talk about what happened with COVID. So I was able to put together some pretty incredible guests and have the conversation. And it was kind of threefold. What did we do right? What did we do wrong? What do we need to fix? And then on the emotional side, I took 183 phone calls and I listened to the stories. And over 90% of them were family members who were not able to be there with their loved ones when they died in the hospital, and their loved ones died alone. And still to this day, that hurts. I can't even imagine what it would have been like for me if my mom was still alive and she would have had a cardiac episode and we would have had to have been in the hospital and I couldn't have been there with her.
Yeah. Has there been enough of an accounting for what happened with COVID? To me, it feels like we just moved on like it never happened.
No, there hasn't been enough of an accounting at all. No. I think the numbers are starting to come out. I think the insurance actuaries are going to be very telling, but it's going to take this administration pulling everything back and actually putting out the actual science, not the bought and paid for science that we've been seeing. I think the first thing that we have to look at is double-blind placebo studies not being done on any of the vaccines that are out there now. I think that conversation needs to happen. And I think that then we need to talk about what mRNA technology actually does because we have no long-term data on it. But the fact that even hepatitis B vaccines that are given to infants in their first, hour of life, which, correct me if I'm wrong, but an infant is not having unprotected sex, nor are they using dirty needles for drug use. So why are we vaccinating them within the first hour of their life when there's never been a double-blind placebo study done, and the manufacturers of the vaccines have immunity.
Are you feel good about RFK Jr. being in his position, and maybe we'll get some movement on these issues?
I do, and I believe that what Trump, the people that are put in place, Dr. Bhattacharya, Dr. Marty Makary with Secretary Kennedy, I think, and him working also with Brooke Rollins at Ag, I think that there's some pretty incredible minds that are all coming together, and they know how to look at data, they know how to look at research, and they won't be compromised by the soda lobbyist or the chemical lobbyist. I mean, we just passed a bill in Arizona, and Secretary Kennedy came out, and we did a press conference and a roundtable and talked about some things that we can do in Arizona and what they can do to help us. But we passed a bill that bans 9 chemicals and dyes from school lunches, and it was signed into law. But banning soda from the SNAP program was vetoed.
Yeah, there was. So you guys tried to do that on the state level, and it was shut down. Mm-hmm. Yeah. Mm-hmm. And of course, there was the controversy of conservative influencers who. Did you see that? A bunch of conservative influencers came out in favor of keeping soda in SNAP, and then it turns out that a lot of them were maybe getting money from the soda lobby. So that's the way that goes.
The American Heart Association sat on the floor in Texas Assembly and testified that there's no correlation between juvenile obesity and soda. That's laughable. And that's actually, it scares me that the American Heart Association, who is our gold standard in healthcare, like I have to do ACLS training, which is basic, it's life support, for healthcare providers. So you would, as a layperson, would do BLS, which is just CPR, and we do it with the actual drugs as well, right? And so we do those testing every 2 years. When you're working in a hospital, the only accredited training that you can go through every 2 years for your ACLS is through the American Heart Association. Well, what kind of validity do they have when they have someone sitting on the Texas Assembly floor making a statement like that? We know what sugar does. Yeah.
And the medical field in general, I mean, you as someone who's experienced, obviously had a career in it. To me, I look at it, it seems like the credibility of the medical field has just collapsed over the last, in particular over the last 10 years. And we could go through the list of, as you just said, denying, the role that sugar plays in obesity and junk food plays in obesity, the COVID vaccine, so-called gender-affirming care, all these things that are coming out now about ADHD meds and the psychiatric drugs they have kids on. And you start to look at it, you say, well, can I trust anything these people say? Which is very troubling, because if you can't trust you should be able to trust your doctor, and if you can't, then what do you do with that? Where do you go from there?
I've made the statement many times that I actually am very grateful to God that I was pulled out of the healthcare industry, because I don't think I could watch it from the inside and keep my mouth shut. I've never been one to be quiet, hence the reason why I'm in the operating room. I don't mind standing up to someone to protect my patient. And so now I'm sitting in a different position where I can try to help with the laws, but I also believe that so with the Trump administration stopping the weaponization and giving us the right information, then I believe the state can then come from the bottom up and take our power back, because we should be more in control of it. So everything gets tied up in money, and then you get handcuffed with mandates, and that's what they follow. And the reason it's pretty hard in Arizona right now to take your child and find a pediatrician that will take care of your kiddo if your kiddo is not fully vaccinated, because the insurance won't pay unless they have a specific. It's a little bit over 80% of the patients have to be vaccinated. So if you're not already one of their patients and you come in with a kiddo and your kiddo's not vaccinated, they won't take you on as a new patient. And then we have a 264% deficit in primary care physicians in Maricopa County alone. So it makes it very hard to even get good health care. And then you start thinking about how bought off it is. That's wrong. So then how do we navigate back to trusting our doctors and our nurses? And I think healthcare needs a shakeup. I liken it to taking an Etch-a-Sketch where you try to fix it and it just makes it worse, it needs to be redrawn. We need to think outside the box.
What would a shakeup look like? How do you shake it up?
You know, I don't know, because it's very simple, but yet I don't know how it gets done because it's so convoluted. And that is, it should be based on outcomes. If we were actually basing our healthcare on outcomes, instead of basing it on diagnosis and billing codes, we would have a healthier country. Because then everybody is focused on making sure. And you have non-compliant patients, and then the hospital shouldn't be held accountable for that. Well, that's very true. But what more can you do to make sure that your patients are compliant? Is it a lack of education? Is it a lack of access? How do we fix that? But instead it becomes checking off boxes to make sure that we're doing all the things that are mandated so that the hospital gets reimbursed.
Do you think this is one area where maybe there could actually be there's a hope of some sort of bipartisan, maybe not among politicians, but at least in the culture, some kind of bipartisan agreement, at least on these issues of, getting chemicals out of the food, vaccines, just some of the basic health-related stuff. Could there be, you think there's some hope of agreement across the aisle on that?
I do, because what I see, I've worked with some pretty incredible healthcare providers, and I have faith that there are good people in healthcare that are getting bad information. So if you get garbage in, you're going to get garbage out. So if we can get science back to what it's supposed to be, it is actually about the science. It is about the data. It's not who's paying for the study. It's not about what organization's CEO is making amount. Kellogg's, they're branding all of their cereals with the American Heart Association. And it just came out that there's a link with a lot of the money that's going on. I mean, those kinds of things have to be fixed so that I think that the regular person that trusts in that will start to trust that we have better information with our healthcare providers. And I think once they have the better information, I do believe there will be a shift.
Well, speaking of shifts, it's kind of interesting on the vaccine topic in particular, because when you think back, let's say 10 years ago, and if you were to imagine someone who was maybe skeptical of vaccines, had questions about vaccines, it was generally, now there were certainly conservatives who had that position, but it was often considered, you often thought of the left-wing kind of hippie granola, the kind of crunchy sort of, and so generally it seemed to be something that people on the left maybe gravitated towards a little bit more. And then with the COVID vaccine, pretty much all of the criticism of the COVID vaccine came from the right. And now it seems like on the left, they have suddenly just started reflexively defending every vaccine.
Yes.
When, again, 10 years ago, that, if anything, was a little bit more of a left-wing position. So I guess maybe that cuts against the idea that there could be kind of some agreement here, because everything's so polarized that people on the left are saying, well, if we're being skeptical of vaccines on the right, then that means that we have to defend vaccines.
Who's paying them? That's what I want to know. When we're talking about people that are actually coming out and standing up for something that we have data that shows they are wrong, and they continue to double down, I want to know who's paying these people to double down. I mean, when you have a lack of knowledge in that area, that's completely different, but that's not even what we're talking about now. Aaron Siri has taught so many people, including myself. I had no idea that there was only a little over 500 babies tested with the hepatitis B vaccine prior to it going out to every child in this nation. If people actually understood that without the rhetoric, if we could just sit down and look at it, and that's why I'm so hopeful that the partnership between President Trump and Secretary Kennedy is that they'll be able to do that. But I don't know that they're ready right now. I couldn't get the Democrats to participate in the roundtable or the press conference with Secretary Kennedy. And I have a pretty good relationship with a lot of the Democrats because I'm very pragmatic, and I am who I am. Everyone knows what I stand for, but I'm willing to work on things that we can work on, and I've proven that. And so when I went to them and asked them, please come and join us in this conversation, they wouldn't join. And so then afterwards, I asked, is there any possibility that we'll ever get to a point where we can actually sit down and have this conversation? And there was one senator that said, I sure hope so, because it is important. So maybe they're starting to think about it, but one thing with politicians is it's about re-election a lot of the times. And so then it's testing the wind.
Yeah. What about your future? Are you looking at national office as the next move, or
No.
anything? No?
I have no political aspirations whatsoever. I made a commitment that if the citizens of my district re-elect me, I will serve out a full term, which is 8 years, and then I'll term out in the Senate, and then I'm going to go home. And I hope to go back to the operating room. I hope to go back to being able to hold people's hands when they're in the oftentimes scariest moment of their life. To me, it's another day in the office. And to someone who's never been in surgery, it's one of the scariest things that they could ever go through, because you have no control. And you have people telling you things, and all you see is this, right? And so I take that very seriously. My mom was sick my whole life. I spent more time bedside in a hospital than I ever did on playground. So when she passed, the grief was so immense. I was advised to maybe start volunteering at a hospital, and that maybe by giving back to others, I can get out of myself and deal with the pain of losing my mom. She was my only parent. And so next thing you know, I'm being sent to surgery. And it was because the director of surgery was walking behind when I was showing a family to the waiting room. Their son had come in for an emergency appendectomy. His appendix had ruptured. He was 17, and his parents were very scared. And I was just being myself and walking them, and the director of surgery heard me. So the next thing I know, when I show up to volunteer, I get sent to surgery. After a few times of being in surgery, not understanding why I was there, the director called me into her office. And of course, I'm a little ornery, so I thought for sure I did something wrong. It was like going to the principal's office. But she says, "We need nurses like you. People
Wow.
that can talk to people and be that conduit, because you are able to talk to them because you understand it." And so it took her a while to convince me. I was in middle management. I was very happy in my job, but she convinced me. I went to nursing school, and I already have a degree in molecular biosciences and biotechnology, so I didn't have to take any classes. I walked right into nursing school and graduated second in my class. And so I went to surgery after 2 years on the floor. I went and got my assessment skills, and I went to surgery, and it's the me madre rule is why I did it. And that is, I want every patient to get the care that I would have liked my mom to have every single time.
So you want to get back to that? You don't have dreams of being in D.C.?
No.
That's
No.
unusual, in a good way.
I suppose. I think that's what makes me a little unique. I mean, obviously, I'm unique anyway. I don't really match down there, right? But it makes me unique in the fact that I am here to serve. I am not here because I covet being an elected. And so if I get to stand for my principles and march to my own navigational north, and that's what my citizens in my district elected me on, and I continue to do that. And if they vote me out because they don't believe in that, then so be it. But I'm going to keep marching to that, and it gives me a freedom of, you can't scare me about how I need to vote based on how I'm going to get beat up on social media, or how it's going to get spun to look bad, or I'm this, that, or the other. I'm supporting Karen Taylor Robeson for governor, and because she is the Trump-endorsed candidate, that's causing me getting a little bit of flack, right? As a staunch conservative, as a MAGA Trump-endorsed individual, that has given me a little. But I believe in the Trump administration. I believe in President Trump's vision, and I'm going to support it all the way through.
What if this DEI bill is vetoed? What's the next step in fighting DEI? Where do you go from there?
You run it again. Again and again and again until I get it across the finish line. You know, there's some bills that were started a couple years before I got to the Senate that then I was asked to pick up and run, and it took me 2 years to get across the finish line, like dangerous crimes against children. So it actually elevates the penalties. I have made it a mission to make pedophiles' lives hell in Arizona. And if you rape a child under the age of 12 in Arizona, you'll spend the rest of your natural life in prison, and that's because of the work that I was able to do with Kaylee Kozak. And so the dangerous crimes against children, that took 4 years for us to get it across the finish line, 2 years with a previous senator and then 2 years with me. So sometimes that's how it works down there. And that's the one argument against term limits, because sometimes it takes a long time to get things done, but it's the will of the people, and term limits is how they want to do it. And so that means you have to figure out, navigate the system, and get to work right away.
Just keep chipping away, like we
Yeah.
said.
Yeah. And never giving up on it, right? I mean, some of the other things that I'm never going to give up on is I believe that if you're going to provide care to transition kids, you better provide care to detransition. I don't understand. There's not even any diagnosis or billing codes for detransitioners. That's horrific to me.
Yeah. Well, they're just abandoned.
They abandon them.
They're left out in the wild
Yeah.
to fend for themselves.
And I met Chloe Cole early on in my career and have been working with Do No Harm. And it's incredible what I've discovered that they're still doing. And when I have a medical malfeasance bill giving a detransitioner up to the age of 26 the right to sue for something that is done to them as a minor. And the reality is if you're not doing anything wrong, then this bill doesn't matter, so you should sign it.
Where does that bill stand right now?
It's going to get vetoed.
Yeah.
Yeah.
I appreciate you coming all this way, and you're doing incredible work.
Thank you.
And,
Thank you for having me.
And thanks for the conversation. Great conversation.